Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's start with the CPT codes for the chest X-ray series. These codes report the number of views taken during the exam: 71045, chest X-ray, single view; 71046, chest X-ray, 2 views; 71047, chest X-ray, 3 views; 71048, chest X-ray, 4 or more views. Use 71045 for a portable AP chest when only 1 view is taken. If 2 views like PA and lateral are captured, report 71046. For 3 views, PA, lateral, and apical, use 71047. And for 4 or more like AP, lateral, and bilateral decubitus, report 71048. Some common views used in chest imaging include PA and lateral, AP supine or portable, apical or lordotic view, lateral decubitus, right or left. Report coding breakdown exam, portable chest, 1 view, header AP portable chest radiograph, history, infection, comparison, chest radiograph from May 20, 2020. Findings: normal cardiomediastinal silhouette, no airspace opacity, no effusion or pneumothorax, no acute bone abnormality, bilateral AC joint degenerative change, impression, no acute cardiopulmonary disease. This is a single-view chest radiograph performed portably using an anterior-posterior projection. Since only 1 image was taken, the correct CPT code is 71045, radiologic examination, chest, single view. The reason for the exam is infection, but the radiology report does not confirm a specific diagnosis. There's no pneumonia, bronchitis, or other defined condition documented. Since there's no confirmed finding and infection is a vague clinical indication, we must code the symptom or concern. The most appropriate ICD-10 code is R09.89, other specified symptoms and signs of the circulatory and respiratory systems. This code covers general respiratory symptoms when documentation doesn't specify a condition. It's appropriate for rule out or evaluate for infection when the report is negative. Correct chart coding summary: CPT 71045, chest X-ray, 1 view, and ICD-10 R0.89, respiratory symptom unspecified. Always ensure coding reflects both the documented views and the clinical reason for the study, not just the final impression. Report coding breakdown order: CPT 71046, exam, chest, 2 views, header, PA and lateral chest radiographs, history, infection. Comparison: January 27, 2011 findings: normal mediastinal, hilar, and cardiac silhouettes, right middle lobe consolidation with bronchiectasis unchanged, no pleural effusion or pneumothorax, no acute bone abnormality. Impression: chronic consolidation in the right middle lobe, likely related to chronic infection. Superimposed acute infection cannot be excluded radiographically. This exam includes 2 views of the chest, posterior-anterior, PA, and lateral. Since both standard views are documented, the correct CPT code is 71046, radiologic examination, chest, 2 views. This is the default CPT code for routine chest imaging when both PA and lateral views are obtained. The clinical history is infection. The radiology report confirms a chronic right middle lobe consolidation with bronchiectasis and notes that this has been unchanged on imaging since 2006. Although acute infection is suspected, it's not confirmed. Therefore, we code only what is documented: J47.9, bronchiectasis, uncomplicated. This code captures the chronic lung changes seen in the report and aligns with the documented findings. Avoid using a code for acute infection like pneumonia, since no new infectious process is definitively identified in this report. Summary of correct chart codes: CPT 71046, chest X-ray, 2 views, ICD-10 J47.9, chronic bronchiectasis uncomplicated. Remember, when the radiologist describes chronic findings and doesn't confirm new or acute pathology, your ICD-10 code should reflect the established diagnosis, not the suspected one, unless specifically documented. Report coding breakdown exam: chest PA plus lateral with apical view, header, PA, apical and lateral chest radiographs, clinical history hemoptysis. Comparison: chest radiograph from October 5, 2017. Findings: normal mediastinal, hilar, and cardiac silhouettes. Status post-CABG, coronary artery bypass graft. no focal airspace disease, no pleural effusion or pneumothorax, right shoulder arthroplasty is partially visible, surgical clips and median sternotomy noted. No acute cardiopulmonary disease. This study includes 3 views, PA, lateral, and an additional apical view. Because the exam extends beyond the standard 2 views, the correct CPT code is 71047, radiologic examination, chest, 3 views. This code should be used anytime 3 distinct radiographic projections are taken, including specialty views like lordotic or apical, to evaluate for pathology higher in the lung fields. The reason for the chest X-ray is hemoptysis, which means coughing up blood. The report shows no acute disease and no cause of the symptom. In this case, ICD-10 should reflect the symptom since there's no confirmed diagnosis. The correct ICD-10 code is R04.2, hemoptysis. Always code the symptom when it's documented in the history and not explained by the findings. Don't assume a diagnosis like pneumonia or malignancy unless it's confirmed in the impression. When a study is normal and symptoms persist, code the clinical reason the test was ordered. Summary of the correct code for this report are CPT 71047, chest X-ray 3 views PA lateral apical, ICD-10 R04.2 hemoptysis, exam chest 4 views, header AP cross-table lateral and bilateral frontal decubitus radiographs. History, croup versus possible foreign body, respiratory distress, comparison, none available. Findings, normal cardiomediastinal silhouette, loss of normal tracheal shouldering on frontal view suggesting subglottic edema, croup, lungs well inflated with symmetric aeration, no focal consolidation, no pleural effusion or pneumothorax, no radiopaque foreign body, no definitive signs of radiolucent foreign body, bowel gas pattern is unremarkable, no concerning osseous abnormality. Impression, subglottic edema consistent with croup, no radiographic evidence of a foreign body. This study includes 4 distinct chest views, AP, anterior-posterior, cross-table lateral, left and right decubitus frontal views. The appropriate CPT code is 71048, radiologic examination, chest, 4 or more views. This code covers any combination of 4 or more chest projections, especially when evaluating for subtle pathology like air trapping, foreign bodies, or croup, which require additional decubitus or specialized views. The exam was ordered for respiratory distress with differential diagnoses including croup and foreign body. The radiology report confirms subglottic edema, which is a hallmark of croup. The correct ICD-10 code is J05.0, acute obstructive laryngitis, croup. This code is supported by the documented finding of tracheal narrowing and loss of shouldering, classic for croup. Although a foreign body was considered, none was seen, so no additional diagnosis code is assigned for that. Code confirmed findings, not just suspicions. In this case, croup is diagnosed, and the imaging directly supports that with the finding of subglottic edema. Summary of correct chart codes CPT 71048, chest X-ray 4+ views, ICD-10 J05.0, croup. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. Disclaimer: CPT is a registered trademark of the American Medical Association AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines.